Our coronavirus crisis is a long way from being over. Victoria has set a grim new record of 484 new cases. Sadly, 2 more deaths, both men aged in their 90s. I'm joined now by Dr. Stephen Parnis, who's seen the virus in action across 3 of Melbourne's busy hospital emergency departments. And Doctor, it's been another shocking day. The Premier of Victoria tells us the majority of people are not isolating, even when they're waiting on their test results. What would you say to them?
What I would say is that the entire community is our front line, and everyone in that front line needs to play their part. Unless we isolate, test early, wash our hands, wear masks, unless we do that without compromise, the numbers every day will get worse, and I will continue to see some very sick people coming through the door multiple times every day.
Is there a misconception, do you think, that people don't need to be concerned if they're not elderly?
It's a complete misconception, Layla. The fact is this virus does serious harm to young people as well. I've seen a number of those just in my own experience in the last few days. Now, these signs are a bit unpredictable, but the fact is that anyone who gets this is at risk. And the more people who are infected, the more serious cases we will have and the more deaths. It's not something that is acceptable to anyone, really.
Yes, sorry, Doctor, for interrupting. Are those people that you see, they're suffering with COVID-19, are they shocked they got it? Are they shocked that it's as bad as it is?
They're very surprised, and the worst thing is those stories where they inadvertently received the virus from a loved one. And there are people who have minimal or no symptoms who can transfer this, and they're horrified because they feel responsible, sometimes even for the death of a loved one. What I'm saying to all Victorians, indeed all Australians, is it could be you. Unless you take those isolation measures, this is not a joke, it's not a drill, you've got to do these things because it will save lives. There's absolutely no doubt about that.
Well, how long can we keep up? Can emergency departments and hospitals keep up with this rise in infections if it just keeps going up and up?
Yeah, the good news is that Australia's had a few months to prepare for this. We got past that first wave and we've ramped up all of our disaster readiness across the health system, particularly in Victoria. But with the rate that this virus is capable of spreading, if it gets out of control, then we could see scenes here that we saw in northern Italy or some parts of the United States. And that is not something that any of us would want. And that's why the answer is to do what we need to do now and to acknowledge the stress that every single one of us is under. Because if we can acknowledge that, then I think we're part of the way to overcoming it and being effective at isolating the virus.
Well, are other states in danger of looking on and thinking it won't happen to them? How likely is it that they'll go the same way as Victoria?
It's always the case that these things could spread. My concern is that New South Wales could be where Melbourne was 4, 5, 6 weeks ago. There's no room for complacency, and even the other states that have had wonderful records in recent weeks, it wouldn't take much for those things to change. This isn't about panic, it's about being ready, it's about doing the drills that we've learned, all of us, over the last few months.
The masks will be mandatory in Victoria from tonight. Are you expecting that to make a big difference?
I think it will if they're used in the right way. The evidence is clear from overseas that any sort of face covering can reduce spread. It's not perfect. None of the measures that we have are perfect. But if we do all of these things, then we can drive this down. As I said, we've done it once already and we can do it again, and I hope that we will.
OK, Dr. Stephen Parnis, thank you very much.